Take a look at our top story. The United Kingdom's chief medical officer has now said that social distancing will be needed until at least the end of the year. This comes as the United Kingdom has reported over 133,000 cases and over 18,000 deaths. Now, these measures will be imposed even as the United Kingdom reaches the peak of the pandemic. Professor Chris Whitty says it is important to realize that social distancing measures will be needed to stay in place for quite a long period of time.
I think we have to be very realistic that if people are hoping that it's suddenly going to move from where we are now in lockdown suddenly into everything's gone, that is a wholly unrealistic expectation. We're going to have to do a lot of things for really quite a long period of time.
He also added that normal life will only return once an effective vaccine or treatment is available. Now, Britain is currently in its 5th week of the lockdown. The country remains under strict restrictions that only allows people to leave home for essential services. Now, just last week, the government announced that the stay-at-home orders will be in place for at least 3 more weeks. Meanwhile, the UK Prime Minister Boris Johnson appears to be recovering and could soon be back at charge. And the Prime Minister was discharged from the hospital almost 11 days ago. The United Kingdom is also planning to introduce contact tracing at a large scale. An NHS app for tracing COVID-19 positive patients continues to be in the works. Now, we are being joined by our London Bureau Chief, Mandy Clark. For more on this, good evening to you, Mandy. Now, the United Kingdom's chief medical officer has said that social distancing will be needed until the end of the year.
Or longer. Yeah, absolutely. And I think that was the message that the British public didn't really welcome. But he wanted to make it absolutely clear that life doesn't go back to normal until there's a vaccine. Otherwise, what the Prime Minister is really worried about, since he's had firsthand experience at that intensive care unit, is that second wave. And the worry about a second wave in infection is that it will strike and the NHS simply can't cope. So this disruption he's referring to is these social distancing measures, and it means that life won't return to normal. We don't know if that means schools will reopen or if they'll reopen on staggered days. That is some conversation, but it's clear that schools won't reopen likely until September. So they are forecasting long-range disruption for the British public. And what Boris Johnson, the tone he took when he finally really started to take COVID seriously, there has been an accusation that during February they just weren't taking it as seriously as they should. But when there was a step change in the government's taking it seriously, they said, we will level with you. And I think this is part of them just being upfront and honest that Britain, life as normal, will not be normal until there's a vaccine.
Right, and we are hearing reports that the number of COVID-19 deaths may be double what has been recorded if they now include the deaths that have not been reported in hospitals.
Yes, absolutely correct. The problem is how deaths were measured, and each country is measuring deaths differently. The way the UK had started was only measuring the deaths of confirmed cases of deaths in hospitals of COVID-19. Now, that just simply takes out any deaths in nursing facilities, in prisons, and also at homes. And that was also that's only the people who died and were a confirmed case of COVID-19. So they were only testing a small population. It's not surprising that now, re-looking at the figures and the number of deaths, the ONS, which is the Office of National Statistics, looked at the normal period of they could expect in a death around this time, what they're seeing, and they, rather than testing each case, they say in all likelihood this is COVID-19, and that's why we're seeing this enormous bump in the number of deaths.
All right, thank you for that report. That is our Bureau Chief Mandy Clark joining us live from London for the latest on COVID-19 there.